Studio guest has a smooth solution to all your cellulite problems, and you don't even have to exercise. Find out what all the buzz is about. And still to come, it's what every woman doesn't want to see in the mirror. And now, after years of testing, there might be a solution to the problem. No one wants to admit they have cellulite. Our next guest has an innovative cellulite treatment that may have the answers we're all looking for. Our next guest, Dr. Shalini, is an award-winning scholar, surgeon, laser specialist, and cosmetic consultant practicing in Beverly Hills. Well, today she's here to talk to us about the latest breakthrough in the fight against cellulite, Velashape. Thank you so much for bringing all of this information to our studio.
Thanks for having me, Heather.
And explain a little bit about Velashape, because I've been seeing it a lot. Rachel Ray, Today's Show, it's kind of the buzz, Kim Kardashian. What exactly is Velashape?
I know, Velashape is amazing. It's a revolutionary new technology that it's the first actually in the world of its kind. And it's made by a company called Syneron, and it's the first FDA approved device to actually shape the body to reduce cellulite and for circumferential reduction. And what that means, reducing inches in dress sizes or pant sizes.
And this has been awesome for me because after the baby, I know they do like kind of back to get your body back, you know, before the baby. And I've been coming to see you. And I have to tell you, I'm amazed at how many inches I've lost. And I'm not really the best patient because I went on vacation and I haven't been that consistent, yet it's still working tremendously with me. I mean, is that normal?
Exactly. It's not surprising. It's actually the beauty of this technology is that it is consistent. And in very relatively few treatments, you're going to see results. And usually it's a package of 4 treatments weekly apart. And you've only had just a couple of treatments, and if I can say, you've already lost 1.5 inches. It's amazing.
It really is. And also, I know we're showing a lot of video of how it works. And when I first went to you, you said it's kind of like deep tissue massage. I mean, I'm just laying there on the table, and you, poor thing, have to do all the work. But it really is. It's kind of a relaxing. You just lay there. Somebody works on you on the table. But again, I mean, it's not something that you do so many things. When I was writing all your credentials, I mean, you have so many credentials, but you had to actually take courses or learn about Velashape.
Yeah, definitely you need. There's an intense certification involved and training involved in the Velashape technology. But the beauty of this technology is relatively safe. It's you know, it's the non-surgical alternative to liposuction. Basically, it's not, of course, a weight loss procedure, but it's something to effectively reduce fat and cellulite, and that's nothing on the market like that.
And the before and after pictures are amazing. I mean, the ones that I've seen that we have here, some of the women that have had children like myself, and you know, you work enough on that one area, and it really can reduce it down to a flat stomach. And that's something, like you said, you used to have to go and get liposuction to do.
Exactly. And it can only be achieved because it's got a synergistic approach to technologies. You know, Syneron has patented a very unique technology that's not around. It's called ELOS, and what they do is they couple different energies, for example, infrared and bipolar radiofrequency current, to actually heat up those fat cells and actually metabolize them and eventually reduce those fat chambers. So if you think of them as these large grapes, which are your clusters of fat cells, and reducing and removing the fat from that and reducing it to a size of raisins. And that's what basically achieves. And then you add vacuum technology and massage to actually improve the skin texture on the surface as well, in addition to the rest of the technologies.
Are you seeing an increase in people, you know, responding to Velashape? I mean, are people hearing about it and calling you up and wanting the service?
There is a buzz because there's nothing out there on the market. You know, if you look at the procedures performed today, liposuction is probably the most common procedure. People are very body conscious, but it's also the #1 cause of morbidity among surgical procedures. So there's a need for that on the market, of something that's, you know, non-invasive, that's something that's consistent, there's no downtime, that's painless. And this is the most amazing technology that's out there that can actually do that. And there's the science that's backed up behind it.
I know that you told me you have supermodels and you have celebrities and then you have everyday people. What is the ideal candidate to get Velashape?
The ideal candidate is anybody who wants to lose areas of body fat where, you know, regardless of how much they're dieting, of how much they're exercising, they just can't lose those little metabolically determined areas of body fat. And this is usually genetically determined. And those little pot bellies that we have, or love handles, or the saddlebags. You can go to the gym and nothing can reduce those areas, and there's nothing to spot reduce until this technology's come along that you can actually focus this heat energy and actually melt away the fat on those areas. And it's non-invasive, and that's the beauty of it.
I mean, are there any side effects at all? I mean, I haven't seen any personally. I mean, it's been the dream for me, but are there any side effects people need to worry about?
Because it's safe, the technology, that there's minimal, you may see some redness in the area, that's very temporary, or very minimal bruising in rare cases, but it's very safe, and you won't see any.
And if you're a good patient and you stay on your diet and you exercise, I mean, will these results last?
Definitely, they can last even 6 months to a year if you're pretty good with your diet. And those who are not even consistent with their diet will just need little booster treatments every few months or so.
And usually like 4 sessions. Is that pretty much a person that's close to their ideal weight and is a good patient? I mean, is that really all they need, or do you find that some people need more?
Some people may need less, some people may need more, but if you want to see significant reduction, 4 treatments is what's been shown in the studies, and there's been an average of about 3 inches reduction just in 4 treatments alone in the studies that were out there.
And Velashape isn't the only thing that you do. I mean, when I was reading through your bio, trying to write your intro for this interview, I mean, tell us a little bit about you personally and your background.
Well, I'm a medical doctor, and I graduated from McGill University, so it's a pretty much well-renowned for research, and so I became very research-oriented in my medical career. And most importantly, I'm also an ophthalmic surgeon and also an aesthetic laser surgeon. So my field of expertise is now becoming more in laser technology, and I use my research to see what's the best groundbreaking lasers out there, and then I have that in my practice. And I have a practice in Beverly Hills, and I see a whole gamut of people from mothers to men to cover models to celebrities. They all have the same issues. We're all the same.
Yeah, we're all people, and we all struggle with the same issues. And again, if anybody's interested in Velashape, I know just me personally, I highly recommend it. But again, you have so many other things that you do. They can contact you at your Beverly Hills office, and I know we have that information, and also the information for Velashape. And thank you so much for coming on our show and helping me get my body back after the baby, after the third. It's hard. And also, we'd love to have you back on to talk about all the other things that you do as well.
Great, thanks for having me.
Thanks, Shalini.
Thanks, Heather.
And basically, that's what we do. To see more of our show, you can log on to SouthernCaliforniaLife.com.